you know, to be putting your heart and soul into nursing somebody to sustain life. It's just a massive devastation when I've got no words.
They're pretty stressed out. It's taken its toll on them. They're anxious, and the anxiety comes in many different ways, shapes, and forms. But a large piece of it is that balance between I have family. How do I navigate my needs, my family's needs versus my job, the public good, my mission? And I think that's weighing on people pretty hard.
We've all stood at the doors and watched them be carried out. We've all cried, we've all had, even though we shouldn't, we've all had hugs, we've all talked about it to each other. You dread coming to work next morning or next afternoon in case another one's passed away.
We're just powerless to not be able to do anything. We've got fluids up, we've got oxygen on the go, you know, you name it, we've got it. And it's futile.
They will be watching people who may contract the virus prematurely losing the fight against life. And I think that's very harrowing. What you have to remember in care services, they have attachments, they become a family within that service.
We look back and we think, is there anything we could have done? And I think when we've discussed that as a team, we've realised that there is not much else we could have done apart from make the people comfortable. But I think that's what hurts most is we've known some of these people 5-6 years, created relationships with them. We know their family, they're like our family, and then you just feel helpless when something like this gets in.
It's not the type of thing you go into because you need a job. It's too hard. And we expect people who are in healthcare to be used to dealing with death, and they are, and we've all had patients who've passed away, but not at this scale, not so quickly. And I think that that's been very, very difficult, that someone looks pretty good today, they're pretty healthy, and then a week later, they've gone on a ventilator and they haven't made it. And the mortality is very high.
I think they're devastated about being seen as forgotten and that they've been undervalued for so long, and yet they're coming in every single day.
We're at war was a second thought. All you hear is protect our NHS, protect our NHS, PPE to the front line. We're just as important as the NHS. We try to keep people alive, just like they do in hospitals.
Well, we were expendable really, I suppose. That's what it felt like, because nobody really cared about the care homes.
A lot of times, these are the forgotten people. So there are groups of people who this is their job, this is their role, and we take them for granted almost all the time. If you leave, there's no one there. So even in a hospital emergency room, if I don't feel well today, yes, they need me, but I can still call out sick, and they'll scramble, but they'll manage to figure out how to manage with a little bit less. In nursing homes where staffing is much lighter, but especially in someone's apartment where staffing is you, if you're not there, the care doesn't exist and that person's at risk.